Participants from member states in Southeast Asia and the Western Pacific, experts from WHO collaborating centers, partners, colleagues and friends. Good morning and welcome to the 18th Bi-Regional Meeting on Influenza Surveillance and National Influenza Centers. My thanks to our colleagues at the WHO Western Pacific Regional Office for co-hosting this meeting with us. We are all here today to strengthen influenza surveillance, preparedness and response, not just to protect our own populations, but to reinforce global health security. My thanks and appreciation go out to you for your continued dedication to this important work. Influenza, whether seasonal, zoonotic or pandemic, remains one of the most pressing challenges to health security in the Asia-Pacific. Responding to this requires us to tackle persistent systemic vulnerabilities. This calls for investments in surveillance and laboratory networks and access to services and medical countermeasures. And yet, we face these calls in a time of undeniable global financial constraints. The global underinvestment in pandemic preparedness of approximately $10.5 billion annually disproportionately affects low and middle income countries, including in our two regions. We have to bridge this gap, not just for sustainability, but for equity and resilience. Implementing the international health regulations and advancing universal health coverage demands nothing less. There's reason for optimism. The landmark Pandemic Accord reinforces global collaboration, promotes equity, and establishes the pathogen access and benefit sharing system. These will strengthen and support the efforts of you and your predecessors of more than 7 decades through the global influenza surveillance and response system. Colleagues, the threats are real. The United States recently had an outbreak of H5N1. So too did Cambodia, India and Bangladesh in our two regions. The need for surveillance, timely laboratory confirmation and coordinated response capacities is clear. So too is the urgency of integrated One Health approaches and cross-sectoral collaboration. We must invest in primary health care, strengthen core public health functions, and collaborate across borders. Our actions today will shape the health and well-being of generations to come. The Pandemic Fund, along with the Pandemic Influenza Preparedness Partnership and other funding mechanisms, provide opportunities for the necessary investments. They can advance initiatives such as the Global Influenza Strategy, Mosaic Surveillance, and PRED. Since COVID-19, countries have begun integrated approaches for influenza and other respiratory pathogens. This is sensible and smart. It increases efficiencies and cost-effectiveness and provides a foundation for stronger regional pandemic response capacities. I encourage you all continue working together for evidence-based practical recommendations. On that note, I wish you all a productive meeting and look forward to being appraised of the outcomes. I thank you.